Hello boys and girls, and welcome to Storytime at UNG. Today we're going to hear a story of R.E.M. and his medicine cabinet. Once upon a time there was a sweet 65-year-old Caucasian man named R.E.M. R.E.M. was retired and lived in his house all alone because his sweet wife had passed away. Although he lived alone, R.E.M. is never lonely. He has 3 adult daughters who live close by with their families. R.E.M. is never bored either. He keeps himself busy cleaning the house and working around in his yard. When he is not hard at work around the house, R.E.M. likes to go bow hunting and fishing. You would never know by looking at R.E.M. he has as many health problems as he does. Just 5 short years ago, before he had to have that coronary bypass surgery, his medicine cabinet was empty. R.E.M. never really thought he had any health problems. He didn't realize until he was older that smoking a pack of cigarettes every day for 50 years would be harmful to his health. All his friends were smoking when he was young. After all, he doesn't drink alcohol or use any drugs. Other than smoking and drinking a couple of cups of coffee and an occasional glass of sweet tea, he doesn't have any bad health behaviors. Now in his medicine cabinet, he has an ACE inhibitor, which is lisinopril, and a beta blocker, carvedilol, to control his blood pressure. He takes pravastatin to lower his cholesterol levels. He has a benzodiazepine, which is temazepam, to help him sleep. And he takes a baby aspirin to prevent his blood from clotting. There are many factors R.E.M.'s healthcare provider must remember when prescribing these medications to him because he is elderly. R.E.M.'s renal function and liver function must be closely monitored to ensure adequate metabolism and proper excretion of the drugs. Even though Beer's criteria advises against taking temazepam due to the risk of injury from a change in mental status, and there is a serious warning of coma or death if taken with opiates, R.E.M. assures his healthcare provider he takes the sleeping pill only when it is needed, which is no more than a couple of times in a week, and only takes it right before bedtime. Every day when his phone alerts him, R.E.M. takes his medicine. He knows how important it is for him to take it, and he never misses a dose. Even though there are many potential adverse reactions to his medications, he has not experienced any of them. R.E.M. knows what side effects should be reported, like the muscle cramps that were intolerable when he was taking that other statin, fluvastatin, for his cholesterol before his healthcare provider changed it to pravastatin. Why in the world one statin would cause muscle cramps and one didn't was a mystery to R.E.M. until one day when he had a nice conversation with a nurse practitioner student from UNG. She explained there are 2 different types of statins, hydrophilic and lipophilic. She explained fluvastatin is a hydrophilic statin and pravastatin is a lipophilic statin. The student explained there is a genetic test to see which statin would be better tolerated and less likely to cause muscle cramps. R.E.M. sure didn't know he could have a test to see which statin would work best for him. If he had, he could have avoided those horrible leg cramps in the first place. R.E.M. is thankful he is now taking a medication that he can tolerate, and his medications are working to control his blood pressure, decrease his cholesterol, and help when he's having trouble sleeping. Because R.E.M.'s medications are generic and he has a prescription insurance policy, his medications are affordable, which is the major factor of medication adherence with R.E.M.'s limited budget. The end.